All right, thanks. Amy, we'll go ahead and start at you whenever you're ready. Just let us know.
I just got a thing up that said we're now streaming live on YouTube.
Yep,
Okay.
we are now live streaming.
Thank you. We're going to go ahead and call the Kent City Board of Health meeting to order on May 12th at 5:28 p.m. We normally would welcome any visitors, not seeing any in the Zoom waiting room, so we'll go ahead and proceed. Is there a motion to accept the minutes of the previous meeting of April 14th?
So moved.
Is there a second?
A second, I just looked at that.
Okay. Any corrections, comments, additions to the minutes? I have one. We had a visitor last meeting, and I know it's just a colloquialism, but if she's a former Kent State graduate, I think that means she didn't graduate. So nobody's getting the subtlety there but me, I guess.
No, I'm looking at Mike, and Mike is, yeah.
So I think she's a Kent State graduate. She's
Right.
not a former Kent State graduate.
Right.
Like if you undid it.
Yeah. Yeah. She gave her diploma back.
She's no longer.
Yeah, she gave it back, so.
Okay, we'll make that correction for sure, because I believe she is in fact a graduate. Okay.
Are there any other corrections, additions to the minutes? Hearing none, all in favor, aye.
Hi.
Opposed, same sign. And motion carries. Thank you. We are asking for open comments from the medical director. Angela, if you would like to give any welcoming comments.
Okay, Joan's spinning her laptop around to me. Hi, everyone. It's great to be here.
Ooh,
Uh,
that's a lot of
You have to
feedback. I wonder if that's
turn
too
off one of the
close.
microphones.
Yeah, I think,
Mike, your computer or whoever's other
there
computer.
we go. Still hear it.
Is that better?
That's much better.
Okay, great. So, terrific to be here. Nice to see everyone. I look forward to meeting you in person one day. I mean, I would just say, as Joan was saying, this is a challenging time for public health, but we'll do what we can to make sure we make evidence-based decisions, medically appropriate decisions, in whatever way I can help with that, and maximize our partnerships in the community so we can get the best possible outcome for Kent and the county right now. So I think Joan has my contact information. If anybody wants to reach me for anything, just here I am. Great to be here.
Great.
Thank
Well,
you. Thank you all.
Wait, can you go over what Access Point provides to the community?
Oh, sure. Yeah, I'd be happy to. Access Point is an FQHC, federally qualified health center. So it gets some federal fundings to function as a safety net clinic. So uninsured, Medicaid, any private insurance, we pretty much never turn anyone away for costs or insurance coverage. But it's a primary care clinic. We have a dental clinic as well. We are also doing medication-assisted therapy for addiction, Suboxone therapy. So working with Town Hall 2 and the other agencies to provide that piece of the treatment. We do have a women's health center also, but it's in Akron. They have 5 sites and one of those is in Akron. But we are actually doing more women's health at this Kent site as a result of Planned Parenthood losing the Title X funding. That funding has been made available to FQHCs now. So Access Point is a resource for that service in the community, whether that's STD testing or contraceptive needs, anything along that line. Access Point is doing that too. I think that about sums it
That's
up.
great. That's
Yeah.
good to know. Yeah.
We have very, very few COVID tests. We have tested a few people. We really don't have enough supplies to do it on a more widespread basis, although I think we could be a resource for that when this stuff becomes available for a testing site.
That would be wonderful if you you were able to serve in that capacity. It's certainly sorely needed in this area.
Yeah, I mean, you know, it's the PPE issue too, because you got to don your PPE to test a person. So it's not efficient to do it for occasional people here and there. We really need to be able to do it at a volume to make it worthwhile.
Yeah.
Yeah, I'm hoping that's in our near future.
Great. Well, welcome aboard. We look forward to many successful years with you as our partner.
Well, thank you. It's great to be here.
Thank you.
I'll give you back.
I feel like this is kind of like a milestone for our health department. I really do. I think that we're going to have some opportunities to grow and expand and have more strength in our relationships with the agencies that are in the area, and that will just benefit everybody in the long run. So very, very excited to have Dr. DeJulius with us.
Absolutely.
And then
Go ahead, Joan.
Go ahead.
I just say, I heard Jack mention to someone that the council has not had a chance to vote on a new board member, so we won't have any comments, right?
No. But we are looking forward to that, and that'll be nice to round out the board again too.
Right. So I will go on and move, excuse me, move to reports. You have the statistical report for April in front of you.
And
If you have any comments for the health commissioner, now is the time to ask.
I would just add two things as I was looking over this, and I'm sorry, Tracy, who prepared the report, had to leave, so I wasn't able to talk with her in person, but under the health department, monies collected under April 2020, you'll see right under tattoo establishments, there's a miscellaneous 2 overpayments. And that is part of the refund from the AOHC classes that I was supposed to take. And last month there was one as well from getting those checks returned because they didn't hold the classes due to COVID. So that's why you see that amount there. And then on the next line for the PEP safety grant, that's part of our insurance. I was just trying in my mind to sort through why in April 2020 and year to date there were funds. There was 0 for April 2020, but over $3,500 under year to date. But looking back a year ago to this time, there was 980.01, but 0 year to date. So I want to ask Tracy if that was a typo or if that was just the way the money was distributed or paid. So I do have a notation to ask and clarify about that. So. But I don't know if there's any other questions I can answer for the board about the statistical report.
Anything for the health commissioner? Okay, hearing none, we'll move on to the health commissioner's report.
Okay. So the first thing I want to do is just give a brief COVID-19 update. If we have not heard enough about that already, I did want to at least share with you that our under our unified command team, we did have a reconstitution plan that was passed, and that is just how we're going to reopen the city and our businesses based on what the governor has outlined. So it was very nice that Portage County EMA actually shared a template with us that we were then able to edit and form into what we needed to use. And it certainly fits our needs now. And we looked at things like staffing, creating appointments, how are we going to have to set up spaces so that the public could come in safely. They're looking at instituting some ante rooms, and again, a lot of use of appointments. And we're looking at that as well in terms of just throwing open the doors. I know the Bureau of Motor Vehicles was looking at an online scheduling where you would have to make that kind of appointment and then you'd come in at that time to limit the numbers of people just walking in off the street. We do have plexiglass up and we do wear masks. We do wear face coverings at work if we're in a shared area. So we are trying to follow those edicts. And then again, signage as well. And so the city's working on getting some signage out as well. And that's about it for reconstitution. The Stay Safe Ohio, of course, the emphasis here is not that we're not back to the way things used to be, but this is a phased in opening with limitations. It's still, the main directive is to stay at home, but to go out for those things as you need them. Again, I think retail opened today, but it's not a shop at will. It's a go get what you need and then leave the store. so that we're not supposed to just be browsing because it's been a long time since we've had that opportunity. So, yeah. And then I believe that on Friday, we have the outdoor opening of a patio and bars. Tattoo parlors are able to open. Body piercing will go live, so to speak. And then salons will be able to open up again as well. But some people, even though they're allowed to, have been calling us and saying, we don't feel like we have everything in place. We're not going to open just yet. And that's the approach you're supposed to take. If you don't have everything in alignment with what the Stay Safe Ohio plan is, then you should not open. We're doing a lot of consultations with retail businesses as well as with restaurants to make sure that they're safe to open. And there's a lot of planning from the city side about changes in the way how we do things so that restaurants can be more of a draw. So we're looking at things even like, just making the downtown a little bit easier to have more outdoor seating for restaurants. But again, very kindly, they're including the health department in that planning so that we can have input for the safety aspect, not just of the customers coming, but of the food as well. We want to make sure that there's no secondary outbreaks during this time. We don't want that. So that's basically what I had for a COVID-19 update. Does anybody have any questions? Are there any concerns, any rumors that you've been hearing? I know Chris did a really great presentation for the fire department because there seem to be a few myths or maybe skepticisms out in the community. And so the fire department asked Chris to speak with them, and he did a great presentation that just really laid the facts out and then, talked about dispelling the myths and what the actual facts are behind things as we know them right now.
Well, thank you.
Okay, all right. Well, then the other item I had was just I wanted to update the board that we have been looking at budgets for 2020 and we'll start, I think the 2021 budget is due May 15th. So I'm working on that. We were asked, based on the state saying that they were taking away or reducing their budget by 20%. We looked at a 20% budget reduction as well. Ours, I want to make very clear, is only in operations and maintenance at this point. We have not taken anything from programming. We have not taken anything from personnel. So we have not furloughed employees. We have not cut employees' pay. We've not asked them, to give time back or anything like that. So right now it's all under operations and maintenance. Some of that has had to actually be for our move to PARTA. So that's kind of slowed that process down. The other was we took a little bit of a hit in travel, education, and training. So we're trying to see how that will play out. But right now, since a lot of the travel workshops have been shut anyway, it hasn't had that great of an impact, and we're trying to find things online learning as well. So then in terms of our move to PARTA, we have delayed that because first of all, we are so busy and in the thick of things. It was a very stressful time to try to have the staff move on top of all the COVID activity and then the reopening activity and just trying to do the day-to-day. So we don't have a set timeline or date yet for when we will try to make that move, but I just wanted to let the board know that's why we're not there, because honestly, we should be there by now. If COVID-19 hadn't happened, we would be holding our board meeting at the PARTA building at this point. And then Justin had asked me to talk a little bit about the ServSafe Person in Charge program. He's converting that basic or entry-level 1 class to, it's like a pre-packaged program from the ServSafe people. And what it will do, it will help to meet the person in charge class standards. They do all the handouts. It's a pre-packaged program. Justin just kind of has to run it. It will be a little bit different in terms of the costing, in terms of us creating all the handouts and doing all the PowerPoints and Justin's time doing all the preparations. So his hourly cost is kind of shifted into the cost of just having and purchasing this program. And then the people who attend do get a certificate at the end from ServSafe. So we felt that that was important to do. So he'll be doing that and setting up for that, I believe, in June. And then in terms of the EPA Mosquito Grant, as I said last month, that was approved. Justin did hire 3 interns. We did have a discussion internally about does that make sense when the city has a hiring freeze? Not, should we hire interns, or should we wait and see if people get laid off and then offer these positions to them? But because of the nature of the grant, they had to be students. They could not already be employees. So internally, the health department could not pick up those hours. So that's why we went ahead and hired the 3 interns. So that is pretty much what I have for the department. Is there any questions or any concerns there?
Hearing none. Thank you, Joan. That's very informative, and we appreciate all that you're doing to keep the city safe. It's yeoman's work, I know, but you approach it with such a passion and such concern for our citizens that how could they not but just love the fact that you're now in this position.
Oh, well, thank you.
Thank you for all you do.
Lucky.
Yeah, oh, thank you. I feel very, very fortunate to be here, that's for sure. Yeah.
Do we have a FEP or communicable disease report?
We do not. I think because of the activity surrounding COVID, we do not have a report this month. We did hear through what was a daily Monday through Friday meeting with Portage County. They were supposed to open up their vaccination clinic again at Portage County. It will only be held there. It will be by appointment only, and they're going to see how that operationalizes. They were even talking, I think today, about perhaps doing it outdoors, like as a drive-through.
Oh,
They would open up the car doors. They would do all their paperwork, assess the child, do what they needed to do to safely provide the vaccine, but it would all be done outside the building as opposed to bringing multiple families with children in for their clinics. So we'll see how that works, and then they'll share. But at the time, Kent residents can make an appointment and go there for vaccines.
okay.
But
So we're not going to have vaccination in the city.
Correct.
Okay.
I mean, at this point, we'll do vaccinations.
That's
I
interesting.
mean, you have to make an appointment, but
Well,
for example, if it's a child that needs multiple vaccinations and they
yeah, and I'm thinking
want
starting
to do
maybe
it in a
small,
more
yeah.
traditional medical setting, they can certainly
Okay.
call access point.
Okay, well, so there's an option there. Yeah, because I think the only other pediatrician in the city of Kent is not offering vaccines, that he relies on that clinic to send his
Yeah.
patients to. But you will take pediatrics as well as adults for
Oh, yeah,
vaccines?
Well,
Okay,
childcare, I mean, they're gonna want to establish as a patient, we're not just gonna do
A
a drive-through
vaccine.
vaccine if we don't know you, but
Right.
I mean, it's primary care,
okay.
pediatrics, sure.
So, okay, well, that's good. That's all right. There's one solution to a problem
Mhm,
already.
yeah.
So, okay, well, that's something that then we could advertise
Yeah,
as an option if they wanted to stay in Kent.
Yeah,
Okay, good.
that's super. Thank you, Angela.
sure.
So seeing no other reports that are needed to be discussed, we'll move on to any discussion items. Joan, did you have something you wanted to?
I don't have any other discussion items. I just added that one point under action items.
Okay. Does the board have anything that they want to discuss? So I know it's been an ongoing concern of the board to consistently not get FEP and communicable disease reports. And this is obviously right now is a very extraordinary time. So, that is an extenuating circumstance, but we are needing to have that conversation, I think, with our provider and figure out a way to make sure that we're going to get consistent monthly reports.
Okay,
And if that's not going to happen, then to me, that's a violation of the contract and we need to address that.
okay. Is-
Okay.
Chris, would it be helpful to them if we changed the schedule, if it wasn't monthly, but every other month, something like that? Or you just,
I don't
we
know.
would
We
really
could
need-
ask.
Yeah.
We could
Yeah.
ask. I know Rose had been coming once a quarter to deliver
Right.
monthly reports, but
But we hadn't seen her in a while
no.
before this even.
Yeah, I think Mike was just noting it was February was the last meeting she was able to attend. So, okay. Was there anything you would like me to do in the interim? Do you want me to reach out and ask if there is some alternative?
Well, I think part of my concern is now that we have a brand new reportable disease, it would be important to reflect what Kent City numbers are relative to county numbers. And so
Right,
that there was a rolling living document to reflect those numbers. And I know you do such a great job telling us what they are, but we want to make sure that there's an actual official record of the reportable diseases. And if they're not going to supply those, then we need to figure out a way to get them in an official capacity.
okay. Okay. So I know I have reached out to ask, for a line list and to be updated on numbers. There was some disagreement in terms of how that information might be used, but we did have discussions with individuals at the state level, and they said that as long as we were clear and didn't traverse the HIPAA privacy, that we could publish our numbers and we should have access to our data and to our numbers. So,
Yeah, I think Hope already gave us the thumbs up that as long as we're not publishing anything other than the number, which is, in my opinion, all that we really need to know as a board, so that we can look at trends and make sure that we're mitigating whatever the circumstances that's leading to an upward trend.
right, okay. So is there some other way that you want me to reach out and have that discussion?
Um,
Or do you want a formal memo from the board? I don't know if you want to just wait and see another month, or if you feel like you have enough information or enough questions that you'd like more information.
Yeah, I think I like your suggestion. Let's, if it's okay with the board, wait another month since they were just here in February and see if they show up for the June meeting. And if not, then maybe at that point, we have a frank conversation about how we're going to get those data points for our own records.
Okay, all right, very good.
Is that okay with the board?
Absolutely.
Okay, thanks. Okay, moving on to action items. You have in front of you the expenditures and encumbrances report. Is there a motion to approve?
So moved.
Is there a
Second.
second? Okay, thank you. Are there questions or comments about the expenditures and encumbrances for April? So the two indigents, so here's a case in point. Do we know if those were COVID related or not?
I believe that one was, just based on the fact that Tracy does the vital stats and processes those death certificates, but I would have to verify with her and double check, but I believe one was COVID related.
Okay, so this is what I was trying to get at. We would need to be able to understand the total number of cases, the total number of fatalities, et cetera. And so that would be helpful to get from our contract.
Right, but then that would mean, but I think this was one of the ones that it was a former Kent resident from a nursing home. So actually so it was one of those in but out cases.
We don't claim that as.
But we don't claim that as a Kent
death in
City,
our city.
yeah. But let me double check to make absolutely clear.
But if we don't claim it as a Kent City, why is Kent City paying for the burial?
Yeah. Yeah, so let me double check and make sure that I'm speaking correctly about both of those cases.
Okay,
Yeah.
thanks. Are there any other questions about the expenditures and encumbrances report? Hearing none, all in favor of approval of the expenditures and encumbrances for April, say aye.
Aye.
Aye. Opposed, same sign. Hearing none, the motion carries. Unwritten on your agenda is an item number B, letter B. And you received a late email from Mike regarding signage that Parks and Rec was hoping to have our approval of. So I don't know if you have a chance. And then Joan, if you want to speak to it.
Sure, and and actually I can provide a clarification because I was not at my computer when I shared that information with Mike. So I went back and I reread the email. Parks and Rec is already using that sign, but Mr. Roller wanted to use that similar sign in downtown Kent on some of the lamp posts in Dan Smith Park, which is a park and a space that's shared by multiple areas. So we wanted to make sure that we had some signage there, and the actual would be for $225, there would be 15, that's 15 signs. And as Mike brought up, it would be nice if they could change out the logo instead of Parks and Rec, put maybe City of Kent, Kent City Health Department on either side of it. But yeah.
Did we ask them about that possibility?
I just received that from the city just a few hours ago. I would say 2 to
Okay.
3 hours ago. So I hadn't had time to ask that.
Sure.
And
I was
they,
just curious.
yeah, they were just making some initial, I think, questions to see would we be willing. And I didn't know if that, if for $225 for 15 signs, if that's something that we would just accept, or if we would ask, does anybody else want to partner with us, to pay for a portion of the cost? But I'll leave that up to the board to decide, what you would like to do.
So do you have partners in mind?
Well, I didn't know if like City Services or Main Street Kent, I don't know what their ability is to pay. I think everyone has budgetary concerns right now, but 225 did not seem overly burdensome to me, even in light of trying to be very budget neutral with expenses.
Anyone on the board have a comment regarding this?
I was comfortable with the price. I just wondered about the logo, but I also understand, if everybody's doing the best they can. So if they can't put the health department logo on, then.
I think it should be the ask that the logo be changed. I think that would have to be a contingency personally. I don't know, maybe I shouldn't speak up.
Yeah, if we're gonna pay for it, definitely.
Agree.
Is there a motion to approve the expenditure for the signage?
I motion to approve the expenditure pending on the logo change.
Okay, is there a second?
I second.
Okay, Emily, thank you. Is there further discussion on the motion? Hearing none, all in favor, aye? Aye.
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 Opposed, same sign? Hearing none, the motion carries. Okay. Is there other business to come before the board? Is there a motion for an executive session? Hearing none to either, is there a motion to adjourn?
So moved.
Second,
Second.
we stand adjourned. Thank you so much for your time.
Thank
Really
you.
appreciate your ability to hang in there with us through this time when we can't be face to face.
And again, I do apologize for the miscommunication about the start time. Thank you for being so gracious and for patiently waiting for us to join.
No
No
had a good-
I
problem.
didn't even realize you were wearing a mask. So, because I'm so used to seeing everyone, it didn't even faze me that you were wearing one.
Yeah,
I was like,
okay.
It was
All right.
nice to catch up with folks while we were waiting.
Yeah.
Right.